While the vast majority of people who use drugs do not want to do so in a manner that negatively impacts others, there have been several high-profile instances of problematic drug use at public locations, including parks, beaches, and around public transit. In addition, there have been concerns from small businesses about problematic drug use that prevents access by customers or negatively affects operations.
Tamara Ugolini here with Rebel News. As the Liberals' oxymoronic harm reduction and safer supply drug strategy rages on, it's Canadian cities and towns that are under siege and increasingly chaotic. As detailed by Liberal MP and Emergency Department physician Marcus Pawlowski, who addressed the Health Committee yesterday, he highlighted how downtown cores are out of control.
There's certainly the perception by a lot of Canadians that a lot of downtown cores are basically out of control. And certainly there's also the perception that around places like safe supply, safe injection sites, that things are worse, that there are people openly stoned in the street, people are getting CPR performed on them in the street, there's needles around in the street, there's excrement in the street.
RCMP Deputy Commissioner Dwayne McDonald confirmed the chaos stirring in Canadian cities and stated that without public buy-in of this drug strategy, the idea of safe consumption and harm reduction can't continue.
One Global News reporter went into the street to find out where all these drugs are going. Turns out they're being resold to other addicts in order to raise the money to buy deadly fentanyl. Will the Prime Minister cancel the dollars for drugs and instead put the resources into treatment for addicts?
Yeah. We are pretty fed up with this fight against evidence-based programs that actually are saving lives. We cannot allow the Conservatives to take us back to the failed ideology of the past. Even Harper's advisor, Ben Perrin, thinks they're speaking nonsense. So just stop it and save lives.
Meanwhile, Vancouver Police Deputy Chief Fiona Wilson says that concerns with public consumption were disclosed to Health Canada prior to it giving British Columbia a pilot project exemption under the Controlled Drugs and Substances Act, allowing for the decriminalization of illicit drugs. The province now scrambles to backpedal and implement additional public protections as police concerns have been realized.
Public consumption in some places may lead to other members of the public feeling at risk or threatened or vulnerable to street-level crime, as you've spoken about. It does present a challenge because it not only creates situations where criminal activity can occur, but it also puts a stigma on people who use drugs that may or may not be engaged in that type of activity. And if we don't have public support moving forward, decriminalization and societal acceptance of that will be an uphill battle.
In fact, all of the concerns that we had have been realized. We've had some really concerning examples of public consumption, despite the fact that, in my experience, the vast majority of people who use drugs have no interest in doing so in front of children, for example, or in manners that I think are problematic. You know, and I have to give our provincial government their credit for doing everything they could to come up with a Public Consumption Act.
Another Liberal MP and Dr. Brendan Hanley, the former Chief Medical Officer of Health in Whitehorse, further validated public safety concerns expressed by McDonald and Pawlowski. In response, Wilson further details what the exemption pilot project in British Columbia really means on the ground at the policing level.
The public have significant concerns about problematic drug use, and when that happens, if it's not in a place that's an exception to the exemption, there's nothing police can do. It is not a police matter in the absence of any other criminal behavior. So if you have somebody who's with their family at the beach and there's a person next to them smoking crack cocaine, it's not a police matter because a beach currently is not an exception to the exemption. That's what we were hoping to have addressed through the Public Consumption Act. The thing I really liked about the act was it did not further criminalize people by virtue of their drug use. Rather, it required police to ask people to leave, and it was the refusal to leave that would have introduced criminal sanctions, as in obstruct. You know, I thought it was a really good balance between what we had previously under the CDSA and also, respecting the rights of people who use drugs, but also ensuring that people in our community feel safe.
Conservative MP Leila Goodridge files a motion in committee to bring forward various bureaucrats to question them about drug decriminalization initiatives happening primarily in British Columbia, which was ultimately adjourned for future debate.
Mr. Chair, I think through the last little bit of testimony we've had here, it has become increasingly clear that there are some very serious issues when it comes to decriminalization, and we are seeing major impacts. And we've even heard from Vancouver police specifically that there are exceptions to the exemption and that this has not been put into play in a way that is preserving public safety. And so I think it is absolutely incumbent on us as the Health Committee to study and to look into the direct implications that it's having in our hospitals. I can't imagine, in reading some of these stories, some of the horrific pieces that we've had to see, and pregnant women being told that are nurses, or nursing moms that are nurses being told that perhaps they don't want to breastfeed their child because there are concerns regarding the drug use in hospitals. And the drug use is so open that people are wearing gas masks.
Addictions specialist Nathaniel speaks to the disturbingly small amounts of these illicit substances needed to cause extreme damage.
There are published case reports in the literature of people dying of overdose from accidental administration of 3 milligrams of hydromorphone in a hospital setting. There are multiple cases of that, and that's why it's a high-risk medication, and why we, go to so much effort to label things morphine versus hydromorphone. Hydromorphone is extremely potent and could kill a person with no trouble if they don't have opioid tolerance. When we look at fentanyl, which is 50 times more potent than morphine, and then you look at the number of grams that a person could hold, that certainly is an amount that could easily kill one or more people.
This discussion comes as data and governmental review prove that the $1 billion federal Liberal program geared toward reducing the harm of substance use on families, individuals, and communities has yielded no tangible results and instead coincides with a rise in overdose deaths and drug use. On a national level, Canada has seen a doubling in overdose deaths, while British Columbia, known as the provincial poster child for safer illicit drug supply under the guise of harm reduction, bears the weight of failed Liberal policy. The Canadian Medical Association Journal, also known as the CMAJ, has discovered that opioids are one of the leading causes of death in Canada for young adults, with 1 in 4 attributed to this heinous policy failure. For Rebel News, I'm Tamara Ugolini. If you've had enough of the chaos descending on Canadian cities, head on over to our special page at fixourcities.com. There you can stay up to date with all of our reports and sign our petition if you would like to see this chaos corrected. All of that and more at fixourcities.com.